Thanks, Dave. I'll highlight one of the cases that we've used or identified as part of our participation in this interesting study. So we had a 72-year-old patient who had been treated for atrial fibrillation with a pulmonary vein isolation and AFib ablation some months prior. Her post-procedural EKG had triggered the Viz algorithm, which flagged it for our clinical team, myself, Dr. Honeycutt, and our colleague, Dr. Gentry. We, at a follow-up visit, we were able to acknowledge that because this EKG, this post-procedural EKG, had highlighted the possibility of hypertrophic cardiomyopathy in this previously evaluated patient, we looked again at an old MRI from some years before, which was looked at the time mostly for pulmonary vein stenosis, and we reevaluated it with the auspices, under the auspices of potential HCM diagnosis, and settled on the fact that this was more than likely a diagnosis of hypertrophic cardiomyopathy that had been missed, unfortunately, at that time. The patient was referred to the hypertrophic cardiomyopathy clinic, which allowed an opportunity to perform additional testing, including genetic screening and family counseling and optimization of medications to avoid the potential for LVOT obstruction. I think this case really highlights what we've kind of been talking about and what we hear so much about HCM in delays in diagnosis, people who are part of being evaluated for symptoms for other reasons, part of the system, but the potential for hypertrophic cardiomyopathy as a contributing factor to their presentation is sometimes missed and delayed for a variety of different reasons. And just using a simple tool like the EKG to highlight again potential cases that may be flying under the radar is a potential helpful adjunct to the clinical practice that we're already participating in.